All right, a very good morning to you and welcome. This is Morning Cafe News, Dolly Stanley Nyiringita. So the Global Bleeding Disorders community will this Wednesday come together to mark the World Hemophilia Day with the international theme this year being equitable access for all, recognizing all bleeding disorders. So today we're having a curtain raiser conversation on this topic to help raise awareness on a genetic, or rather a disorder that the Kenya Hemophilia Association says 1 in 10,000 people in the country suffer from. And to help us have this conversation, two Allans, Alan Were, who's a general practitioner from the Kenya Health Association. He'll also be breaking these numbers down for us, as well as Alan Maina Masharia, yes, from who is hemophilic, yes. And even as we continue this conversation, there's always, is it hemophilia or hemophilia? Both of you will be telling me on a light note, which one is it? Is it H-A-E or H-E? I see both variations still work. But anyway, I'll start with you, Dr. You can introduce yourself further before we begin this conversation, and then you could also introduce yourself, Dr.
Thank you, Stanley. So as you have said, my name is Alan Were, and I work with Kenya Hemophilia Association, KHA. Yes, glad to be part of the show this morning. Thank you.
Right.
My name is Alan Maina, a member of Kenya Hemophilia Association. I'm also a patient, and through the Kenya Hemophilia Association, they've assisted me a lot in terms of the hemophilia condition. Yeah.
For how long now?
I would say it's more than 10 years now. Yes.
All right. Najaribu kupiga hesabu ya miaka in my mind nione, but you'll be telling us when you diagnosed and all that journey. But before that, we can definitely have a background just to understand what this conversation is. Someone watching us this morning may have seen this word somewhere, and they probably know it might mean something about blood, but they don't really know the whole bit of it. Elaborate for us, what is hemophilia?
Thank you, Stanley. So hemophilia, as probably from the word itself, it has a Greek origin. Philia in itself means love. So hemo means blood. So hemo or hymo probably depends whether you're using the United States or British English. So philia, as we said, love, and hemoblood is just an abnormal love of blood to bleed. So it's a hereditary problem where people or patients have bleeding disorders, and they continually just lose blood without having any clotting mechanisms in the blood. So medically speaking, or probably clinically speaking, I would say hemophilia is as a consequence of deficiency in certain factors in blood. We have 3 types of hemophilia. We have hemophilia A, hemophilia B. We also have hemophilia C. So hemophilia A is as a result of a deficiency or lack of factor 8 in blood. Hemophilia B as a result of patients lacking factor 9 in blood. And hemophilia C, which is very rare, so patients have lack of factor 11. And these factors, I know you probably would be asking what they are. We normally have the blood components that help in the formation of blood clots. Primarily, the cells in charge of clotting are called platelets. So before we have the cascade process, before our blood clots, whenever we have injuries or we have any problem, then the blood has to undergo different mechanisms. And in a summary, I would say the blood clotting pathway has like 3 major factors. We have the classical pathway, which has the internal and the external modalities, and then we have the common pathway. So the lack of factors is majorly affecting the internal classical pathway, where the lack of these factors that activate the clotting factors, which then lead to the formation of thrombin and fibrinogen, which are just proteins that form the meshwork in blood whenever we are injured, then we are not able to form them. So as a consequence, patients, when they get injured, they have the love of blood to bleed, as opposed to the reverse, where blood is supposed to form clots. I don't know if I answered that right, but what I want you to take home is this is an inherited disorder. So
at all times it's inherited?
Yes, it is not essentially at all times, but 99.something%. We also have acquired hemophilia, which is very rare.
The sporadic one.
Sporadic hemophilia, which results from patients on very heavy treatment and chemotherapy, and we alter their genetic mutations in the factor 9 and factor 8. And I would say that hemophilia is a disease that affects people generally, like in equal measure or in equal proportion across the world. First described in the European world, it was actually referred to as the disease of the kings, because it first affected Queen Victoria's line, where one of her sons was undergoing circumcision, and they actually bled to death.
Wow.
So that's why hemophilia got its awareness probably from then, and today we're also bringing this awareness home right here in Kenya.
And you talk about matters of awareness. Having the World Hemophilia Day since 1989, so this means, well, it's been a whole journey, even in the country. Yes. Speaking of journey, Maina, tell us your journey.
So, hemophilia, I was diagnosed in 2008 when I was circumcised. That's when I got circumcised in Murang'a General Hospital. One of the nurses recognized that the bleeding is too much, and this patient must be having hemophilia. He suggested it to the surgeon. The surgeon was quite reluctant, but he ordered several platelets, I believe, Dr. Several platelets that...
Why was he hesitant, maybe?
He was hesitant because he considered it to be a very rare condition. The sister continued insisting that the test to be done for hemophilia to be diagnosed. And upon a sample being taken to lab, I was diagnosed with hemophilia A. And through the Kenya Hemophilia Association, she was a part of the group. She suggested my name. The health team was there to help. And through them, the bleeding was resolved. And since then, I've been working closely with them and also been involved much in the activities because they have been so helpful to me. Because despite the circumcision, there are so many other areas that have been having bleeds, and I've been able to acquire treatment through them. Yes.
So before 2008, had you ever, because, okay, at what age maybe were you that time?
I remember back in 2005, 2006 there, I had a bleed on the abdomen here, an internal bleed.
All right.
I went to Kenyatta Hospital. I was admitted, had surgery, but my parents, because I remember very well, my dad told me that when they went there, they thought it's a tumor, but unfortunately it was a bleed inside. They removed a very huge clot, but the bleeding still persisted. But by God's grace, it was able to resolve by itself, but I still felt there is much that needed to be done, despite having that.
So apart from that, the 205 having the internal bleeding, there isn't, let's say, the bruising, because at this age you're young, you're really playful. Kama ni kucheza, that's why you really want to show how strong you are. If you're playing football na maboys pale nje, or some very rowdy kind of games, yes, that mnarushiana mawe just for the fun of it. There wasn't, let's say, sort of an external kind of bleeding that you really had to see. Before now 2008?
I've had several cuts.
Okay.
Several. And let me tell you, it was a very difficult time at that particular time. Because having a simple cut, it would take a very long time.
Roughly how long?
Even hours, 6 to 8 hours for it to resolve.
6 to 8 hours?
6 to 8 hours, imagine.
Ile unafunga bado?
Unafunga, but you see the bandage is still stained with blood. It would take a very, very long time for it to clot or even to stop bleeding. Yes.
So that means, Doki, if there isn't, because you always find one of those kind of young kids who rarely get bruised. The very, labda ni ile discipline amepatia. Wewe nipate for something. So they'll probably train themselves that way. So even before this young kid gets bruised, there isn't any kind of external signs that you'll see that will show you this person might be hemophilic without them actually bleeding.
There could be, because hemophilia, either if it's A or B, we have 3 classes again. We have mild hemophilia, we have moderate hemophilia, we also have severe hemophilia. So the mild and the moderate, we tend to not really have a lot of external manifestations in the earlier stages until probably late. My namesake Alan here, for instance, is moderate hemophilia. So for him, we were able to diagnose him at circumcision, which he would tell you was at like 2008. Patients who present with severe hemophilia, I swear, at birth, you will know. Why?
Oh, okay.
Because children in their initial stages in life, they tend to shed teeth. These are children when they lose any of their tooth, they bleed extensively and they have to seek medical attention. These are people who, when they're playing and probably someone hits them, they would begin to have nosebleeds, and you would see the nosebleeds would not have an end maybe. Or probably at a very early stage, we do immunize babies at birth. So when you're giving the intramuscular injections, or probably the IV injections, intravenous injections, you're able to see the bleeding is taking longer than normal. For normal patients, you just get in with the needle and then that's it. But for severe hemophilia, immediately do that, it's more of a death, troll you're leading these people. So you really have to know from the onset. That's why we're doing this awareness to all clinicians and patients and parents alike, that when you find someone bleeding extensively, probably from unknown reasons, and it's prolonging or taking longer than normal, then we need to know. And one of the things Alan mentioned that probably I also need to highlight is the possibility of having internal bleeds, because bleeding is not essentially meant to be manifested on the external body.
Yeah.
So one of the problems we have with hemophilia patients is some of them might have internal bleeds, and we've lost a number of patients in that regard, because someone has an intracerebral bleed in the brain, you don't know. Someone has an abdominal bleed, you don't know. And you treat them for a myriad of things that you probably do not understand until you subject them to tests and specialized care, then you realize these are hemophilia patients.
Does it manifest the same for young boys and young girls, or is it for one gender? How does it go?
So hemophilia is a little bit biased, which could be a good news or a bad news based on which gender you are. But it's more catastrophic for the males. It's a male problem. And why a male problem? It's because of the pattern in which it's inherited. And I would give a very quick summary here.
Yeah.
So hemophilia, in its inheritance, we have the sex chromosomes. We call them the XY for the males. That is what codes for the male gender. And we have XX, which codes for the female gender, I think.
Yeah.
We were taught this way early. Most of us are familiar with this.
Yeah.
So what happens is hemophilia is an X-linked autosomal recessive disorder. So to mean it only attacks the X chromosome.
Okay.
So I would maybe elaborate it in a layman's term to explain it in this sense. X-linked means it is passed from the parents to the children, or probably in a generational manner. So your great-grandfather could be having it, and then it affects one of the children or grandchildren down the line. So what it means is if a father is hemophilic, then the daughters would be carriers of the disease. If a father is hemophilic to mean he only has one X, so the other Y is paired. And the mother is normal to mean all the XX are normal. So the boys will inherit very normal X chromosomes, because boys get the X chromosomes from their mothers, okay? And they get the Y from the fathers. So what it means is if the mother is free, then the boys are free. And if the father is hemophilic, the girls would be carriers. Carriers because a carrier is someone who has one trait of the gene coded in one of the X chromosomes. So if a mother has two X chromosomes and a girl, probably one of the daughters down the line, has two X. So they get one infected X from the father. One X is free. So this lady is caught free. So that's why it's affecting the males, in the sense that these ladies, they may manifest features of hemophilia. For instance, they may have prolonged menstruation days, which normally should take 3 to 4 days. For them, it goes more than 7 days. And if a mother is a carrier to mean one of the X chromosomes is affected, and the father is free, this mother has a chance that one of their sons would be hemophilic.
So this means even for the mother, or even let's say even for the daughter, it won't manifest the same way. Let's say that Maina had amejikata na kisu ile bahati mbaya, and then there's a prolonged.
No, for ladies, no. For ladies, unlikely. Probably the first point of place we probably tend to know that this is a carrier is when they become of age and they begin having their periods, and then you can actually notice that, you know, this patient could be having 1 or 2 problems. So most of the times how they present, they go to the gynecologist, and then they're probably treated for other things like fibroids, which is long-term. I mean, treatment can only but have an end. And if it doesn't resolve, then the gynecologist would probably refer them to hematologists, and then we are able to know. But in terms of its transmission, it's purely male. The females who may be having hemophilia probably have acquired it through spontaneous means, or like acquired means. Acquired means to mean like if a child is born with a disease, for instance, like the Turner's syndrome, it means they have a defect in one of their genes, and that means this person could probably be having more problems apart from hemophilia. And then to acquired in the sense, we could subject patients to a lot of chemotherapy or radiotherapy to the point that we eat into the bone marrow cells, and as a consequence, we may actually have sporadic mutations in their genes. So as a consequence, they may have acquired hemophilia. In Kenya, I think we've only interacted with 1 female hemophilia patient. But out of our 960 patients, I can tell you all of them are males.
I love the fact that you brought up the 960, and it's mind-blowing to even say that you have interacted with 1 female hemophilic. That's just mind-blowing. But then the fact that you say so about 960 as of now, according to the Kenya Health Association. So even as we come to that, so for you, I mean, have you back tracing even in your family lineage, because it says, well, it's mostly hereditary. Fewer times it's really sporadic where there's no family history on the same. For you, how far does it trace back maybe?
Yes, traces back to my uncle. My uncle passed away, my late uncle. He passed away a couple of years ago. I can't remember the year, but he had the same condition because he had internal bleeds on the legs, but he suffered an internal bleed that cost his life. I also have an aunt who has a son. He's also a member of the Hemophilia Association. He has hemophilia also. And he's actually doing very, very well in terms of management of the condition. And also, I think my sisters, I also sympathize with them because you see this thing is genetical. And what the doctor has explained about the X chromosome, I tell them not to worry when they have sons or daughters, that this condition, where we are at this point in life, it's manageable. But I trace it back. It's far away to my grandmother. Since she's the carrier, she had the X chromosome, passed it on to the daughters. Okay, the daughters have me as the son. Okay, he had a son, so the son was diagnosed with hemophilia, but he was not well aware about the condition, so it cost his life. They were not aware about the condition. It is through me and the Hemophilia Association, through the facilities that we have, that I was able to be diagnosed in 2008. Since then, there have been follow-up and all those things that have been happening. Yes.
Right. So now, because for you, it's so from one generation, from your grandma to the next generation, of your mom and aunties, and now to you.
Yes.
And now you also have the fear that even for the next generation coming, this might also, progress. So Doki, because, I mean, for KHA, Kenya Hemophilia Association says 1 in about 10,000. Quick maths, you need kitu kama, let's say, 4,000, thereabout.
Yes.
4,000 Kenyans. 4,000, 4,500, hapo katikati. You can also tell us maybe how average that is. Have hemophilia in the country. Is this number maybe too low? How did it, and how did the association come to this number? Because for this family tree, there has been a progression from the carrier to the next generation. This is like a whole 3 generations where it has progressed. So there's so many other family trees out here that there's a possibility that from one carrier to the next, is there a possibility that this number could actually have even past the 4,000?
That's very true, Stanley, and I actually appreciate this awareness session you have this morning, probably to create awareness and have a way to go around this. First, I would really want to appreciate Kenya Hemophilia Association since its inception in 1979. And one of the things maybe we should have discussed in this show is, what is Kenya Hemophilia Association and what do they do? So Kenya Hemophilia Association targets to raise awareness and to also offer support systems to patients and their families who suffer from hemophilia. And one of the things they do is to partner with these people who call traditional circumcisers or traditional healers.
Oh, okay.
I wouldn't want to malign them because they really help us a lot. I'll give an instance of what happens in Western Province, where in the Bukusu community every month we have, or in the Kalenjin community, we have these traditional circumcision processes. They have really partnered with them so that during this period of time when the circumcision process is going on, we're able to know how many, let me say, casualties we have from the process. And also, like right now, I'm glad we are on holidays. We have children out here. We do organize circumcision programs at least once a year at the Kenyatta National Hospital and Moi Referral Hospital. So we are able to do the circumcision with specialized surgeons who are able to handle the matter. So Kenya Hemophilia Association has collaborated with the World Federation of Hemophilia as one of its national member states. And its primary role, as I said, is to support patients. And I'll give you how this works. Hemophilia in itself is a very expensive disease. It's a disease meant for the rich. That's why I said it's the king's disease. King's disease to mean as late as, or as early as 2014, our patients had to be referred to South Africa for treatment or to get factors. Until Kenya Hemophilia Association came in, and what we do is we have applied for funding from the World Federation of Hemophilia. So we receive factor concentrates every year that are able to support patients free of charge. So right as we speak, we have like 11 clinics distributed across the country, and every year we are passionate about creating more clinics to create awareness for people to know about this. I mean, we only have 960 patients right now, with a majority being in the central region. We are estimating that we could be having more than 4,000 patients.
Why the central region?
The central region has more hemophilia patients because that's where the awareness has really taken root, and they have benefited much more.
So there's a possibility of it even being more in the western and, let's say, the Rift Valley, parts that you haven't yet reached with matters awareness, but then due to, let's say, the lack of awareness on these areas, you might not really know that there's actually a huge on matters hemophilia.
That's very true. And what people perceive hemophilia to be, I would be very honest. Some communities perceive patients with bleeding disorders to be like a curse. You know, like the woman in the Bible who had bleeding issue for like 12 years. You know, people actually thought of her being a castaway. So in the same network today, we have people thinking that hemophilia is maybe a curse. So people don't want to come out in the open and actually tell you that, you know, Stanley, my son has a problem, he's been bleeding for long. Or like for the ladies, if one is a carrier and they have prolonged bleeding, they're perceived as castaways from the society. So the Central region has benefited much because Kenya Hemophilia Association being rooted in Nairobi, we've been able to cover most of the regions and families in Central Kenya. And right now we have regions across the country. And Kenya Hemophilia Association is structured such that we have clinicians, where I do participate in. We also have patients. Alan is one of the beneficiaries. And lastly, we have parents to patients. So we offer them more of a group therapy and support network all through we as a family. So this show today is majorly meant to enlighten the country that, this is a problem that we have and we have to deal with it.
Oh, yes.
We approximate we have more than 4,000 patients. It could be more than that. But right now we only have 960. So where are these all other 3,000 patients?
So you're reaching out.
A good question, which the viewer should also be part of. In case you've, because so far the Daktari Maina have really enlightened you on what this really means. So you're out there and you're saying, hey, probably I've been bleeding for more than 2 hours. Maybe this is what is happening to me. 0795 045 864 is the number to call in live. Ask all those questions that you have. Share in your opinions, your thoughts on this conversation. At TV47KE, that is on Facebook. You can also text us real quick. Number 2047 is our SMS number. So even as we continue, allow me to take a look at just some numbers to help us continue this conversation. Some of these numbers, we've already mentioned them. Some will also be key as you continue. So first off, so this is data by Kenya Hemophilia Association, which dates back a couple of years. Meant to believe that, some of these numbers have, changed over the years. So first off, we do have at least 5,000 Kenyans who suffer from hemophilia in Kenya. And Dr. Riwera is talking about all that. So far, 960, this is the number of people in the program, the Kenya Hemophilia Association, as well as about 80% of people living with hemophilia reside in low and middle income countries. I'm curious why that is as well. So listen to this. So, there are 14 number of hospitals countrywide that have hemophilia care clinics. Probably too low. We'll be getting to know all that. The hemophilia sickle cell care centers in the county referral centers, about 12, that is according to the Kenya Hemophilia Association. We'll also be getting to know there so far, because last year we did see Bungoma as well as Kitui care clinics being opened. How many care clinics are set to be opened? That is on what the numbers are looking like on the same. Now for you, Maina. Since you recognized 2008.
Yes.
2008. So after circumcision, how old were you at that time? Just for context of this.
I was 11 years old. 11?
Yes. So, so at 11 you're probably grade 5, ama? 11 afako grade 5 at this time. Okay, because I remember in 11 it was like class 5 apo. So at this age, do you even understand when they're telling you, Maina, uko na condition inaitwa hemophilia? Do you even understand what maybe your parents, what the doc is telling you this time? And since at age 11, how do you manage yourself? Is it ni ile you're too careful? Hata ile kwenda kucheza, mwambia Maina kama tucheze ball. Mwambia mimi mama alisema nikicheza ball nitaumia na nitaanza kubleed sana. How was the management as a young child from 11 into getting into adulthood and then now later on?
Okay. So having gone through a lot of bleeding episodes, you begin to learn that the more you have bleeds, the more at risk you are. So you have to be cautious in everything that you do, in every activity that you engage in. So if for me, I loved playing football a lot. I used to play the midfield. I used to be a midfielder.
Number 10 amani.
Nilikuwa nacheza 8 ama 10.
Okay.
So when you learn and experience these bleedings, you have to start adapting to it and know how to manage it and how to go with it. Because if you are reluctant about it, one, I'm in school.
So this is day school?
Yes, I was in day school. But for high school, I went to a boarding school because I was now aware of what is happening. But along the way in primary school, because of now, before circumcision, I was having several bleeds. One of them is nose bleeding. I remember in class 8, one early morning while going to school, I was traveling from Sagana. We lived in Kirinyaga County. From Sagana, I schooled in Murang'a County, here Murang'a Technology Primary School.
Right.
So together with my sister, we boarded a matatu, reached to Murang'a. While going to the entrance of the gate of the school, I started having nose bleeding early morning, and it was quite bad. I had a handkerchief, got soaked. I couldn't use it anymore.
All right.
Removed my sweater.
All right. Could I ask you to pause that story?
Yes.
So that we pick this call. Yes. Being informed, is it Brian Maina? Brian Maina, habari ya asubuhi?
Nzuri sana.
Unatupigia simu ukiwa wapi?
Nakupigia simu nikiwa Lang'ata.
Rudia tena, sijapata hiyo.
Lang'ata.
Oh, Lang'ata. Oh, Lang'ata. Watu sawa. Watu wa Lang'ata wanaendeleaje? Kama unaweza mute simu sauti ya TV ndio endelee kuongea na sisi through in all those questions.
Sawa, watu wa Lang'ata wako salama.
Endelea.
Si tuko sawa tu kulia huku kwa sasa. Unajua mimi ni kijana.
Okay.
Mimi nilikuwa nauliza tu hiyo kuna split. Mimi wana nose bleed. So nilikuwa nauliza hiyo kuna split ni hiyo hemophilia ama hiyo ni ugonjwa mwingine tofauti.
Una nose bleed for how long?
Tuseme tu wana nose bleed. Tuseme ni for how long, but wana nose bleed. So hiyo ni hemophilia ama ni tofauti?
After how often labda?
Tuseme for 15 minutes hivi.
Okay, so let's say for example 15 minutes kama ni asubuhi, itakuwa hiyo siku pekee iishe ama ni mara ngapi kwa let's say kwa siku, kwa wiki?
Tuseme tu hiyo siku kama ni hiyo siku ikianza itakuwa for a while after na iache.
Sawa, salimia watu wa Lang'ata, wacha tupate daktari kujibu hiyo, alafu tuendelee.
Mimi nasalimia watu wote wabezi wote.
Sawa.
Sawa, watu wote wagoteke nyokolox ndani.
Sawa. Asante sana for being locked in.
Sana.
Right. Thank you very much. You can always call in live. 0795045864 is the number to call in live. Our numbers are open. Tuambia, in case you've been listening to this, you've been having quite the lengthy bleeding. And umekatwa kidogo, there's a huge bleeding. Or you probably know someone who is there. Call us live for the questions and feedback on the same. Daktari, can I get your quick feedback on the same for him so that umjibu, then we can continue the Maina's journey?
The question was on why he has prolonged nosebleeds for more than 15 minutes. That's exactly why I'm here this morning.
Okay.
So those are our candidates. We honestly need them to come. The good news is we have made this treatment free for everyone by virtue that this is a donor-funded program. So we invite people like Bran and more to come. We have free consultation services and drugs for free. Problem with excessive bleeding that we also need to point out, apart from death from excessive bleeding, we also have patients presenting with joint deformities. So, I mean, like we have a lot of patients who they have bled so much in the joints and the joints have stayed in that position for life. We can't revert that.
So that means it's weak for them?
Not weak. It is deformed. So joint stiffness. So like let me say someone bled to the point the hand stayed in this position. And that's the position it's going to stay. Or maybe we have, if it's in the knee joint, then the position in which the patient put the knee during the bleed, it stays in what we call joint stiffness.
Right. You had mentioned about matters, the drugs and the free and the cost of it. So we'll get to that. I want so Minor, just finishing it up on. So you're telling us that bit of the nose bleeding, getting into class,
Yes.
Getting around class 8. But then, so even as you continue, so I'm curious now, getting into also in high school, were people around you, your classmates, ni classmates, bado mjafika kama classmates, but your classmates, people around you, even the teachers, do they understand that nani Maina ufai usidhubutu hizi mchezo za kumpiga manini, anaweza anza kubleed sana? Do they understand all that also?
No, most of them did not understand the condition, or even know. Some of them, if you mention hemophilia, would say, what is that? You had to explain to them that it's a bleeding disorder. Bleeding disorder in terms, if I get a cut, I bleed for long. If I nosebleed or have a trauma, I would bleed for long. So the reason why back then people are not aware is because people were not well informed about the condition. So I was actually motivated to actually be part of the motivation program of the Kenya Hemophilia Association all through. And I would say having this awareness is very beneficial for not only the nation and also the whole world. To be aware that if you have a son out there, if you have someone who has been having prolonged bleeding, it's good that you speak out, reach out to us, reach out to our Kenya Hemophilia Association, go to the hospital facility that you have, and you can also get us through our social media handles that will help, that will be able to reach you very easily.
Right.
Because through them, I've been able to reach where I am right now.
How much have you used for the cost of treatment? Since 2011 when you were diagnosed, roughly, how much do you think was used?
In terms of factor, since I joined the Kenya Hemophilia Association, I've used nil.
Nil?
Yes.
Duki, how much, because, okay, so this is a quote of someone who, a mother whose child was diagnosed with hemophilia. She says, so according to the doctor, telling her that the son has a condition that means he should never be hit, and that it has no cure, and whatever management is there is beyond your reach, and you can't afford it. This, when you're telling even a mother this, when the son has been diagnosed, and you tell her that this condition, you cannot really manage it because you can't really afford it. I mean, this coming from a doctor who doesn't really understand. I mean, it's the same kama ule wa Maina mwenye maybe was hesitant because it's rare. Like, hapana, hata kama iko, you can't really manage it. Why the cost of treatment being high? You're telling us it's the disease for the kings.
For the kings, because you really have to spend out of your pocket, which then becomes a problem, because in like Kenya, where it's a disease that affects mostly the low and middle income regions, it's very catastrophic. One, I would say this, how we manage, I think your question is indirectly asking how we manage hemophilia.
And also what really puts it to being that high? That high,
yes. All right. So one, in the traditional conventional way, we used to manage hemophilia by giving cryoprecipitate, fresh frozen plasma, which are derivatives of blood components, and we replenish the platelets that patients lost during the bleeding episodes. And that's why part of the things we need to emphasize in this show this morning is to motivate people to be blood donors. Because in the absence of factors, the first thing we do give patients are these products of blood donations, from blood components that we have in our different blood banks in the country. So what meant is we would need very high numbers.
But a hemophilic can't really be a donor now. As much as kama Maina, hawezi kuwa donor.
No.
As much as he'd want to.
people with diseases cannot be donors. If you go to a blood donation center today and you say you have HIV, you have tuberculosis, or probably on some medication, you'll just be ruled out.
Okay, right.
So we have a lot of young, healthy people in our country today, and we need to call them up to be blood donors, active blood. And they can do that once in every 3 months or 4 months, at least in the year. So what it meant by giving these patients products of blood components, it meant then we had to really look for extreme amounts, or maybe so many people to come in and donate blood, which sometimes never really works out well. So Kenya Hemophilia Association, when it was set up, initially we used to send patients to South Africa, where they could get the factor concentrates. And the factor concentrates here, I talked about them in the initial stages of my process of talking here. And I said, you were to be given factor 8 if you had hemophilia A, and factor 9 for hemophilia B. Averagely, the cost of treatment was extremely high based on what kind of hemophilia you had. So someone like Alan, probably at the end of every month, he needs to replenish his factors. And suddenly that meant 1 vial or maybe 1 concentrate of his factor.
For factor 8 for him?
Yes, it's around 75,000 an injection, which meant, for him, because we calculate the dose according to his weight. So, Alan, you can just see he's healthy, so he's probably pulling more weight than the two of us. So it meant for him, he probably needs like 4 injections in a month. And 4 men.
So each week, so 75 times 4.
Yes.
1 month.
So we do give that at the end of the month, and then if he needs some to go home with, we instruct them on how to use it. We give them more of like another, let me say, some level of factors to also go home with. So it means someone like Alan meant he needed close to more than 300,000 every month for treatment, which, it's not really affordable for our people in the country today. So what Kenya Hemophilia Association has done is it's received donor funding. So we are able to meet patients at that point, and we give them all these concentrates for free. So when they come in and someone is bleeding heavily, you inject the factor. Surprisingly or miraculously, the bleeding stops immediately.
Okay, so according to now from KHA, you do receive funding from the world. Right, so before that, let's go to Thika. Eric, habari asubuhi?
Mzuri sana.
Asante sana for calling us this morning. Uko na swali, uko na maoni unataka kutupatia?
Ni swali.
Yes, uliza tafadhali.
Mi kuna time jua ikiwaka sana wana nosebleed. Ama nikiosha uso na baridi na nosebleed.
For how long?
Inakujanga inaweza tulia for 1 year afu inarudi the other year.
No, okay, swali yangu ni ikianza, tuseme ianze saa asubuhi, saa 2 asubuhi. Saa 2 asubuhi itaenda for how long?
Kama 30 minutes hivi.
Ilianza
damu iclot.
Ilianza ukiwa mdogo ama after umeanza kuwa mkubwa?
Ilianza nikiwa class 8.
Okay.
Niko na kama miaka 10 hivi.
Ukienda hosi labda ushaenda hosi juu ya hiyo ama na ukienda daktari anakuambia nini?
Kuna siku nilidungwa tu vitamin K, shina vitamin K story ya kuclot ikaacha ikarudi sasa after another 3 years.
Right. So asante sana Eric, wacha daktari akupatie jibu sahihi tu. So thank you for calling. Remember, you can call in live 0795045864 is the number to call in live. I'm pretty sure there will be quite a number of callers, and it's gonna like 6 minutes to wrap it up. I'll definitely also be getting your last thoughts, just answering him on the nosebleeds. And this is the second caller just asking the same. And well, for both callers, you can definitely say they are, let's say, 20 and above. Ni watu wame kula chumvi hii dunia. And even as he says, well, it started way back. So that means even matters diagnosis, there isn't the kind of early diagnosis. You could probably answer him.
Thank you, Eric, for the call. Eric could be, I'm not saying he is, he could be one of our mild hemophilic patients who their symptoms really do not get exaggerated. He can live with it. But bleeding for 30 minutes is really a lot. It shouldn't be the case. And he said he's been given things like
Vitamin K, yeah,
which are more or less, let me say, supplements. So again, not everyone with bleeding disorders are hemophilic. That introduces me to the question of the bleeding disorders we have, which Stanley, there are a range. We have Glanzmann disease, we have DIC, we have ITP, idiopathic thrombocytopenic purpura, and the list continues on.
And interestingly, the theme for this year is just recognizing them all.
All, including sickle cell, we do kind of collaboratively support, and that's why if you come to a hemophilia center, we are not really interested in hemophilia alone. We try to figure out all the other spectrum of bleeding disorders and find out. So probably Eric, if vitamin K works for him, he could be having deficiency in vitamin K. But I mean, why has that gone on for like all the years? So he needs to be curious why, And I can call upon him to also come in our centers. Thika, I think, has one of the centers. Or maybe KNH, Kenyatta National Hospital. I'm sure we will really take good care of him. And why I'm saying specialized is because in these centers we have very specialized machines. We call them coagulation maybe machines that we are able to run them through and find out that you're missing this particular element in blood. And again, for treatment, vitamin K supplements are one of the things we give to patients with supplement disorders. Also to note that tranexamic acid is one of the antifibrinolytics that we give, but not for patients with hematuria, like when someone goes out to urinate and then blood comes out of their urine. We have those kind of limitations. So Eric is one of our candidates that we need to see in the hemophilia specialized centers and find out really what they're suffering from.
Yeah. Real quick, before I get your last thoughts, maybe in a minute or less, just an advice on matters diet, because this is one thing that Kenyans would really want to know. Maybe if they suspect that the child is, the young boy is a hemophilic, or they've actually been told. So what happens now in matters diet? Do they focus on diets that have, add all this, add in increased blood, and also, the amount of water and liquids that they take in maybe 30 seconds or less, or a minute?
Sure. Let me say this in general. Once we have the factors, Stanley, a hemophilic patient can live an absolutely normal life, like every other Kenyan.
Right.
They can play football, they can eat anything they want, they can, come to these TV shows like Alan, they can use the public transport, they can get accidents and we can manage them. So it's not a limiting factor to do anything. As long as they can afford a balanced diet, well and good. But I mean, we have diets that boost our blood components or stores, the green vegetables, and fruit.
Right. So even as, I can take that as your last thoughts, as an advice, where can someone reach, because I'm pretty sure there's so many questions around here on the same, where can someone maybe reach the KHA for all this?
So we have a website, Kenya Hemophilia Association. Just Google that in on your smartphone or your browser, you'll be able to find and just
for everything. Maida, even as you also give us your closing remarks and advice maybe?
So for me, I would urge every parent, every person who is having a bleed, like the callers that we have had, that reach out to the KHA. KHA have assisted a lot of people, many boys, many girls out there, me being one of them. By God's grace, I'm a nurse also.
Oh, right.
Yes, I'm a nurse. And through their mentorship, through their programs, through the factors that they give me, I've been able to study and actually be where I am right now. So I'm grateful. So
you're yet training ama bado ndio na?
Nishamaliza, I'm actually working.
Oh, right. So it's two medical professionals in this who are not striking today, on a light note. Thank you very much, Alan Wera, General Practitioner from the Kenya Hemophilia Association, as well as Alan Maina Sharia. He's hemophilic as well as a nurse.
Yes.
Asanteni sana for having this conversation. Reach out to Kenya Hemophilia Association. Just type it there. They have a number there. They have an email. All those contact details. You can reach out and ask them all those questions that you have. Coming up, you've been in the house, uliacha cylinder yako on, your gas cylinder, and umerudi baadaye, and you smell a very funny smell. And you're wondering, how do I, in case of fire, or actually you've experienced fire due to the whole gas cylinder? In today's segment on Monday, discussing first aid, we give you the tips on how to avert all that matters gas cylinders. Stick around for that.